Hello, everyone. I believe we are live right now. Hi, everyone. This is Councilwoman Mai Vang coming to you live from our Heart and Hustle studio for our monthly live chat. Happy December. I hope everyone had a really great holiday break during November. And it's really great to be back on here virtually and in space with our STEAM panel. Today's live chat will be a discussion on the importance of vaccinating our families and in particular our students in South Sacramento. As we enter the holiday season, I'm just going to pause real quick because I'm getting a notification that we're having connection issues. So, I think we're good. Okay. I think we're good. If y'all are tuning in, we're live right now. My team is sending me a message saying we're good. Okay. I just got a notification saying that technical issues, but we'll resume. So again, thank you to everyone who's joining us today. I know that there are other meetings happening in this moment, but if you are joining us live today, thank you so much for joining us. If you're joining us and you're rewatching this, thank you again for tuning in. As I was mentioning earlier, as we enter the holiday season, we're seeing that, we're having more outdoor community events, small family gatherings, and all of that's starting to be part of our normal part of our lives again, thanks to COVID-19 vaccine. But as I've shared with my team and our community, we still have a lot of work ahead. And the more eligible people get vaccinated, the closer we can get to really moments of joy and connection that we have missed so much over the past year. As many of you know, COVID has disproportionately affected the physical and mental and academic growth of our students, of our kids, of our babies. And with increases this past summer and new cases in children, having a kid vaccine, I call it a kid vaccine, was a really critical step in our ongoing effort to protect our community against COVID-19. And last month, the Center for Disease Control recommended children ages 5 and up to be vaccinated with the Pfizer pediatric vaccine. But we know, working through the SAFE Coalition, the Sacramento Alliance for Vaccine Equity, that expanding resources and outreach to our South Sac parents, especially in lower income neighborhoods, have been really critical in the rollout and the outreach. And so I'm really thrilled to be here virtually live with our amazing panelists, which I'm going to introduce you all to shortly. And we're just going to jump right in. But I really just want to thank Victoria Flores. She'll share a little bit about the work that she does. The Honorable Sean Yang from Elk Grove Unified School District, and Rachel Allen, our immunization coordinator from Sac County Department of Public Health. But before we begin, I would love for each of you to kind of share a little bit about who you are, your title and the work that you're currently doing just around the pandemic and COVID before we jump into the question. So with that, why don't I start with the Honorable Sean Yang from Elk Grove Unified School District.
Well, hello, ladies. Thank you, City Council Mine, for having me on with the panelists. It's exciting and it's nerve-wracking at the same time with the topic that we're going to be discussing about, and that's the COVID-19 vaccination situation that we have going on. And I just really excited to be here and share what I know with everyone. Thank you for having me on.
Thanks so much.
And I want to quickly introduce myself. So I am a Elk Grove Unified School District Board of Trustees in Elk Grove. And, part of my day job is I also a engineer for Kaiser Permanente Hospital. So I'm here to serve the community as a trustee. And that's pretty much all I have for now.
Awesome. Thank you so much, Trustee Yang. Just to let all the folks who are watching in, and you're wondering why there's an Elk Grove school board member, it's because in the city of Sacramento and in the district that I represent in particular, there's two school districts that actually is located within District 8. That's Sac City Unified School District and also Elk Grove Unified School District. So I have schools and families in both districts. And so I'm really grateful that Trustee Yang was able to be present today and make time to be here to really share his wisdom and knowledge and the work that they've been doing in Elk Grove Unified. Victoria Flores.
Hi, everyone. I'm Victoria Flores. I serve as the Director of Student Support and Health Services here at Sac City Unified School District. I've been in this role, I believe this is my 7th year. Before that, I served out in the South Sacramento area at Rosa Parks Middle School. Then it became a K-8. I'm an alumnus of this district, much like our council member, Fang, graduated Hiram Johnson High School. So, yeah, yes. I have 2 kids in this district. I live in our community. This, topic is really near and dear to my heart, the safety and the well-being of all of our community members, right? We share families and students amongst all of our boundaries of our school districts. And so this, we've been, working on this COVID pandemic, I think 2 years now, really just active in vaccination and testing and helping to get good quality information out to our families. So thank you so much for hosting this today.
Awesome. Thank you so much, Victoria. And I have had the honor of working with Victoria when I was a school board member at Sac City Unified School District. And Victoria and her team is doing incredible work there to ensure that our families continue to be safe and healthy and really could reach their full potential as students. So thank you so much, Victoria, just for the great work you're doing at Sac City. Rachel, please introduce yourself.
Sure. Hi, good morning, and thank you for having me. I am the immunization coordinator for Sacramento County Public Health. I'm also a nurse. So I've been a nurse for 30 years or almost 30 years, and I'm aging myself there, but and almost all of that in pediatrics. So I did 10 years of inpatient pediatrics. I did a lot of Head Start and community work and also some outpatient pediatrics. And then the last 5 years, I've been specifically working in immunizations, which is so closely related to pediatrics because, it's really where we get, start our protection early for children. So I'm also a mom, and that's the lens. I see all of the work that I do through. That hat never comes off. So I have 3 grown daughters. And so always, looking through that lens and wanting to connect with parents about their children's health and well-being.
Awesome. And thank you so much, Rachel, for really just to you and your team and all the great work that you're doing in Sac County to make sure that our families, our neighbors, and all our babies are vaccinated. So I'm really grateful that we have someone from the county here today and you leading the charge. So thank you so much for being here today. All right, so we're just going to jump right in. My first question, and this will probably go to Rachel, but would love to hear from Victoria as well. Last month, the CDC approved the Pfizer COVID-19 vaccine for children age 5 and older. And we know that parents and caregiver confidence is really critical to achieving high vaccination rates. Yet there are still many parents in Sacramento that are still concerned about the safety of these vaccines. Are COVID-19 vaccines safe for kids and why? And is it safe for children to get the COVID vaccine at the same time as the flu vaccine? So those are 2 parts. But the first question is, are COVID-19 vaccines safe for kids and why? So why don't we start with Rachel?
Sure. Yes, COVID vaccines are safe for children. And, my years of working in pediatrics, I've had hundreds, if not thousands of conversations with parents, and they all come from the same place where we love our kids and we want to make the best decision for them. Immunizations are such an important part of a child's health and a community's health as well. So being able to vaccinate this younger population is really critical, not just to keep our kids safe, but to keep our community safe. So the COVID vaccines have gone through the same rigorous testing and trials as the other vaccines that we give our children. And I know some folks feel like, oh, it was rushed. We were able to get them so quickly. It really, the global funding that, that helped with the manufacture is the part that sped this along. So they still went through the rigorous testing. And, for our kids, they have the benefit of coming, ready to be vaccinated almost a year after we've started this. So we've been vaccinating around the globe people for almost a full year. I think over 7 billion people have been vaccinated, or 7 billion doses of vaccine have been administered. And then also, we look to that 12 when we started vaccinating the 12 and over population. We've done, I think, I have the numbers here. Millions of doses I know that we've given to that population safely. So the data is showing us that the vaccines are safe. And when they are authorized, they look really at the most effective dose. We're looking at effectiveness and safety. And those are the 2 things that we want. And so for our younger population, they did lower the dose to make sure that it's just the minimum dose needed to get that immunity, but to keep our kids safe. So so far, everything is looking great. The trials showed that the vaccines were safe, and we're seeing, lots of kids getting vaccinated in Sac County safely. So I would encourage parents, these vaccines are safe. They're really important to keep your children safe. They're really important for returning to school and sports and life as we knew it. And they're important for our community to reach herd immunity so that we all get back to life.
Thanks, Rachel, for that. Victoria, do you have anything to add in particular why it's so important as well?
Yeah, everything that Rachel said is just so, spot on. We actually gathered our, trusted medical advisors as well. And the one thing I'd add is the risk of getting COVID and contracting that COVID infection is actually so much greater than any concern around that vaccine. And we know now when we're looking at that data that more of our young children are contracting COVID. School, we're doing everything we can to stop that transmission, but we also want to support the social emotional well-being of our students. We want them to be able to have those play dates and gather, and vaccine really does give that added layer of protection. If a student or a child or a family member does contract COVID, even with vaccine, it's protective. It helps them not get as sick, right? So vaccines really protect us, right? And Rachel can probably speak to that part a little bit better. That's really why we feel passionately about educating our families. And I would say if families have questions, come to a clinic. There are people like Rachel with 30 years of pediatric experience to speak to, or medical doctors who can answer those specific questions.
Thanks so much, Victoria, for really providing that insight. I kind of want to shift this a little bit to really talk about the education component. We know that trusted and diverse messengers from our school community matters in outreach, and neighborhood school sites in particular, I believe are really well positioned to play an important role in vaccinating younger children. This question is for all of you, but we'll have Trustee Yang take this one first. As school board members and administrators, what has been done at school sites in your district to really help educate our parents, our children, and the school community about the importance of getting vaccinated?
Absolutely. Thank you for the question. And before I jump to that question, I just want to add quickly to what the two ladies have said about the importance of vaccination for our kids. And to me, I think that it's very vital before you decide to take the vaccine or not. You should ask the doctors or the experts so that you have a clear understanding of what the vaccine is for and what is it doing to your body. Once you have that clarity, I think that the decision you make is going to be so much easier. So I just want to add that to the two ladies. What our school district have done is, we have posted a resource link, as I provided to Ryan earlier, on the Elk Grove Unified School District COVID-19 resources. And what we typically do is we provide a 2-week bi-weekly update that we send to all the parents through email, just giving them, the latest as far as, what is available as far as vaccination, to where, and so forth, because we have different vendors and community volunteers, agencies that provide COVID vaccinations throughout our district. And that's the kind of thing that we do. And also a part of that is we also start taking parents volunteers into our campus and just, do the little things to make sure that the safety of our protocol toward COVID is being practiced effectively as much as we can.
Thanks, Trustee Yang. And what about Sac City, Victoria? If you can share a little bit about maybe some of the work that y'all have done in terms of educating our parents.
Yeah, so we've been hosting vaccine clinics as well, like all of our surrounding school districts have. Since February, we started with our school staff, and we are continuing with our students 5 and older. We're even hosting those out at our school sites in our communities with those lower vaccination rates, really working with our community-based organizations and our partners that, Councilmember Vang, I know you are so connected with, to make sure we have language capacity, right? And that we can help, educate and support our families when they come in whatever, language they're comfortable speaking, and really giving good information so that we're not, just rushing that process along. We have clinics tonight out at, I think today at Elder Creek Elementary. We've got Cerna Center. We've had them here centrally, Stockton Boulevard and 47th almost every week since we've started, as well as Ethel I. Baker Elementary, which is just right down the street, and more to come. So really trying to bring those clinics into our communities and making sure that our clinics serve the whole community so that families can bring everyone they reside with and get a first dose, a second dose, or a booster. We're just learning now how incredibly important boosters are as well. So those are some of the steps we've been taking.
Awesome. Thank you so much, Victoria. I want to go back to a little bit about the vaccine. This past summer, we've read that there was a increased rate of COVID cases among young children. And I wanted to ask, and this actually goes to our school district, our officials and administration, but I think Rachel, if you can help with this as well. As a school district, I'm curious to know what measures have been put in place to really minimize exposure and ensure the safety of our children. That's the first question, and then we'll go into the second one.
Do you want me to jump in on that? Or yeah. So, very quickly, we developed a layered mitigation measure, right, plan, and following that California Department of Public Health guidance, right, masking, we really have, learned is so incredibly important. And here in Sac City, we're even asking our staff and our students to mask outdoors right now, especially when we started seeing that spike that Delta created, and really just wanting to minimize any unmasked close contact, because we know when our children have unmasked close contact, that means they have to stay home and quarantine. They're not able to still come to school. So if we can minimize those kinds of exposures and risks, or make sure we have our masks on, our children can actually still come to school, even if they've had that close contact exposure, as long as they're willing to COVID test. So that's probably, the second layer. Masking, vaccination number one, masking and COVID testing has become really important for our community to be able to keep our students in school in person. If that's the choice the family makes, it's always a choice with what they're comfortable with, as well as, ventilation, hand washing, all of those other, important safety measures, keeping as much distance as we can, and really helping our sites and our communities understand why these measures are so important.
Thanks, Victoria. And Sean, do you have anything to add, Trustee Yang?
Sure. I think all the points that Victoria has mentioned, it's so on point. The only thing that I want to add on to what she already said is that, in the case of a student is found contracted COVID-19 and has been exposed to other classmates in different classes, our protocol, especially in our Elk Grove Unified School District, is that it varies in terms of the different questions that we going to ask the students in terms of their situation. Are they vaccinated? How close are they to the contracted students, and so forth. So we take the measurement based on various of questions that they answer, and then we will take it to a resolution that provides safety for all parties that are impacted.
Thanks, Trustee Yang. Rachel, this question is for you. Oftentimes we hear from parents that, hey, even if I get the COVID vaccine, I can still get COVID, right? And so why should I get the vaccine for my kid? And the question I have for you, as parents are watching and the public is watching this, why is it so important for us to get a vaccine, and how can vaccine actually help minimize the spread of COVID? I think we heard earlier from Victoria, I heard the word minimize exposure, right? Like that is the key here, right? I would love to hear from you, if you can explain why is it that vaccine, or how can a vaccine actually help minimize the spread of COVID-19?
Sure. You know, as with other communicable diseases, vaccines are the key to getting out of the high level of spread. Okay. And that's what we need. We need for the level of community spread to be low enough that we can safely return to life as we knew it. And so being vaccinated definitely decreases the chances that you will contract COVID. And if you were to have a breakthrough case as a vaccinated person, it greatly reduces the chance that you will be very sick, right? We basically have, I've heard this said many times, a vaccine that reduces COVID to like a cold. So that is a manageable illness that's not going to make you that sick. We need children make up such a big part of our population, right? It's not enough for adults to be vaccinated. And it wasn't a surprise when we saw increasing cases in our children because they couldn't be vaccinated, right? When we started to see these wonderful effects of our adult population getting vaccinated, cases coming down, of course, we saw more in our children because we didn't have an approved vaccine or an authorized vaccine. So bringing them into this mixture, they're a big part of our community. It will prevent the transmission, not just at school, not just to teachers, but among their family members, maybe their vulnerable family members who can't be vaccinated, or younger siblings now. Of course, we're still not vaccinating, those under 5. And it will just, continue to make our community, our schools, our families a safer place from COVID.
Thanks, Rachel. I'm going to come right back to you again, Rachel. And I know I asked this question earlier, but wanted to circle back. It is winter. Winter is here and the flu is here as well. And a question that we often get from parents, is regarding getting 2 shots, right? And so what I want to ask you is it safe for children to get the COVID vaccine at the same time as the flu vaccine? Same for children and kids, children and adults.
Yes, thank you for circling back. I realized I failed to answer that. It
No,
is
no
safe.
worries. Yeah.
It is safe. And so several months ago or more, the CDC did come forth with an announcement that it was safe to co-administer the COVID vaccine with other vaccines. And we really, in the immunization world, we really want to vaccinate at the point of contact. So it's harder to get your kids back in the car and come back another time and get a separate shot. They also have flu and COVID vaccines have somewhat similar side effects. So, it's okay to do them at the same time, and your kids may have a day or two where they're feeling a little bit off and then back to normal. So it's absolutely safe to do that. And it's really important still. Flu is another illness that can make children very, very sick. In fact, they sometimes get sicker than most adults. And so we do want parents to remember that kids do need a flu shot to protect them. That vaccine does change every year. So it's a yearly flu shot. And so if they haven't gotten it this year, I would encourage parents to go out and get that. And they can definitely get it with their COVID vaccine. And we take flu and COVID to all of our pop-ups. So we always have flu. So I don't know if they can put our website up, but all of our Sac County pop-up clinics have a flu vaccine available at them.
That's great. Thank you so much, Rachel. Given that all 3 of you are parents, I'd love to ask a parent question, right? What advice would you have for parents who are watching right now who are not vaccine ready? I always try not to use the word hesitancy, but maybe they're just not ready, right? What word of advice would you have for parents who are watching this now and is like thinking about getting their kids vaccinated, but they're not sure? And just really parent to parent, given that all 3 of you are parents. So, definitely want to allow that space for y'all to provide. So why don't we start with Trustee Yang?
Okay, that's a great question, and I think I failed to answer that question. Well, mentioned that earlier when I introduced myself. So myself and my wife, we have 4 kids, and 3 of our kids are Elk Grove Unified School District students, from 4.5-year-old to 14, so preschool to freshman. And I think it's so critical to talk to your spouse and your kids about this vaccine, and try to put it in the perspective as simple as possible for little kids to understand what it's for, and really it's to protect them and to protect their loved ones, because once one is contracted and they live with you, the probability of you getting contracted is so high. So it's protecting themselves and protecting the family, and then protect people surrounding them. And I think that message and that conversation need to take place. That's first and foremost. And I think that when you do that, the ease of anxiety and fear, it's going to go down tremendously. And I know that me as an adult, when I first acknowledged about the pandemic, and then the virus, and then the vaccines come along. There has so much controversial conversation and news that goes on every day, and it still goes on today. And so to me, it's just having that a heart to heart conversation with your family and your little ones. I think that's so critical, and that's what I would recommend for people to do. Rather you decide to take the vaccine or not, go ahead and do that. Myself, I choose to take the vaccine first. Well, because I work at a hospital, I am among the privileged individuals that has the eligibility to take it, and I took it. Just being a elective official, and then a healthcare worker, I just felt so responsible to be kind of like a forefront, and it's just so many layers of things that I had to face first. And let me share a quick story.
Yes,
So
please do. Please do.
so as part of my job working at the hospital Kaiser, I work throughout the Central Valley. That runs anywhere from Vallejo to Sacramento, all the way to Fresno, and then I go to Antioch too. So first CAT scan that I had to go to and to service it is in Antioch. That was known that a COVID contracted COVID-19 patient just been scanned it, and the anxiety that went through my body and my head, that I have to go service it and touch the equipment. At the time, they were saying that it was airborne. It was not, droplet. It was airborne, and it was so nerve wracking. And it's like the protocol was, you don't go in there until 3 hours afterwards, and sanitize and all that other stuff that need to be done for the machine. But you still so afraid to go in there because you just don't know what to expect. So from there all the way till now, there's still the anxiety, and but the thing is, it's everybody's facing it, and to me, I put my trust in the science, because I do work at a science business, and that's the hospital. So I go with that, and I completely understand the other folks who not wholeheartedly trust the vaccine part of it, and but at the end of the day, just ask yourself, what is best for your family and for your kids, and make that decision. Thank you.
Thank you, Trustee Yang, and for sharing just that story regarding the Antioch. Really appreciate your insight. And thank you so much for your leadership as a school board member and as a parent, and modeling why it's so important to make sure that we do everything we can to protect our families and our loved ones. Victoria, what about you as a mother, as a parent? What advice do you have for other parents out there that are considering vaccinating their children?
Yeah, I mean, I would definitely say reach out to your medical provider. They know your child's, health history best. I have a child who had some medical issues early on in life, right? So that's someone is always my trusted source whenever we think something's going on. So that would be number one. Number two, as a parent, both of my children have now had close contact exposures in school. We never think it's going to happen to us or in our family, right? Much like, my firstborn who had medical issues, you never think it's going to be you, but it's someone. And so my oldest was an unmasked close contact, and I panicked. I totally freaked out when she texted me. Actually, she called me. And those of us that have teenagers know your teenager never calls you, right? And that really freaked me out. I thought she got in a car accident. And she was an unmasked close contact. And I had to breathe for a moment and remember, oh yeah, she's fully vaccinated. She served as a lifeguard for the city of Sacramento this summer, right? Got her vaccine so she could do that, that public service. And she was okay. She was able to still go to school. She's a senior. We all know how important that year is. She was still able to go to school, and none of her friends who were fully vaccinated, actually, none of her friends contracted COVID. This was a positive case in their lunch group, right? So that's why they were unmasked. And we still want to support our students eating lunch together, right? And so that's okay. That's a normal, natural thing. We know that this is a risk, though, right? That they might have that exposure. And then it happened with my youngest. Again, she had a close contact exposure. She goes to orchestra, sits next to someone. She was fine. She has good, strong masking, good, strong health protocols. So I think that's the other thing, is talking to your children about if and when this does happen, how you will respond. I'm a working parent. My kiddos are both teenagers now. I'm older. But when they were little, it would be really hard for me to step away from my job right now and be at home in quarantine with them. And I know many of our families are facing that concern, that if their child's quarantined, who's going to care for them? Who's going to work and put food on the table, right? I was raised by a dad who was paid hourly. And when he didn't go to work, he didn't get paid. And so that's very present in my mind. And so for families to really look at the impacts of vaccination in all of the areas of their life, I think that's a really good critical question to ask.
Awesome. Thank you, Victoria. Thank you so much for just sharing your personal experience as well. Rachel?
Sure. So, like I said before, I'm a nurse most of the time, but a mom all the time. So every conversation I've had with a parent is through that lens, and the emotions around our children are so high, and we all share that same goal, which is we want our children to live happy, healthy lives, to grow up and outlive us and be healthy. And there's a lot of emotion involved in that. And I try to encourage parents to remember that we have to, at this point, look at the science, because there's also a lot of mis and disinformation that I think play on those emotions and make us afraid to make a decision to vaccinate children, our own children, based on that. And so it's looking to hard science is a great way to, and again, talking to a trusted medical provider and having those conversations is the best way to really make this decision. And because there's so much misinformation that it can very much sway those parental emotions that we feel, and I think really skew the decision-making process. So, and then as a nurse, I've been around long enough to have seen children sick with vaccine preventable diseases when I worked in the hospital, 30 years ago. And it definitely left a strong impression on me. And I do share that with parents. And there's a lot of regret, when parents have realized that they that they had an option and they didn't, they didn't vaccinate their child, and their kids got very sick. So delaying vaccination is taking a huge risk. It really is. So we know that these vaccines are safe, and we know that they will protect your children. And I would just encourage parents, look at science and make that decision to protect your children and your family and your community.
Thank you so much, Rachel, for providing that insight, and also just sharing from the lens of being a mother. So thank you so much. The last question I have, and we're about to close out, and I know that Victoria shared a little bit about locations where folks could get their vaccine, and we're going to share with you where we usually hold our weekly clinic, but wanted to just pose this question again. Where can families get a COVID-19 vaccine for their children if they want to get one, like right now or today? And I'll start with Rachel.
Sure. So, if you have a pediatrician, that's a great place to reach out. You can also look on My Turn, and there are, a variety of pharmacies and other locations. Like Victoria mentioned, there's clinics at schools, in various locations in the county. And then again, at our website, we put our pop-ups, and we are vaccinating children at our pop-ups. We are happy to have conversations with parents who have questions. We have wonderful nurses that work with children. We're happy to see them. And in fact, it makes us happy to have them come. So, if you find that getting into your doctor is taking a little bit of time, please look at our website and look for one of our community pop-ups, and we'd be happy to have you. And again, just not wanting to delay with the holidays coming. Remember, it takes 2 weeks after that vaccine to really have that immunity start working. So we want to get this going, especially before all these holiday gatherings that we're going to have.
Yes, good point, Rachel, about the 2 weeks. And in 2 weeks actually is Christmas. So, we definitely want to do everything we can to protect our families before families start gathering. Victoria, if you could just share a little bit exactly on some of the locations again. I know you shared it earlier, but if folks are tuning in right now or watching the end of this live chat, would love you to kind of just reshare some of the locations in Sac City.
Yeah, so here at our district office, we host a vaccine clinic every evening from 4 to 7 p.m. Where our Cerna Center building's basically on the corner of 47th Avenue and Stockton Boulevard. You'll see us there. We're here tonight in partnership with Sacramento County Public Health. We're so grateful, yes, to all of our partners. And we will continue that after winter break in January. So yes, please, visit our website. We also are hosting, like we said, specific clinics out at school sites. So tonight, again, in those similar hours, I believe 4 to 7, we're at Elder Creek Elementary. That's actually a second dose vaccine clinic. So they had a really popular first dose one with hundreds of families who showed up. They actually had to run and get more vaccine. And then tomorrow at FLI Baker, they've also done a number of vaccine clinics there. Visit our website and we continue to post and put the link up for all of our clinics. We welcome walk-ins. We welcome everyone.
Thanks, Victoria. Trustee Yang?
Sure. So again, as I alluded to earlier, we bi-weekly, we send a mass email to all of the parents, identify where is the location and time and date that they could go to. And then also, as always, our Elk Grove Unified School District website under COVID resources, just go there. And there is a designated nurse that you could always call, and then also have designated location for vaccinations for COVID-19. So those are the two reliable sources that we normally use to communicate to the community.
Awesome. Thank you so much, Trustee Yang. So I just want to say thank you so much to all three of you for being here and joining me virtually live on Facebook, on Twitter, on YouTube to really share with the community why it's so important that we vaccinate our children and do everything we can to protect our loved ones. For our office in particular and our SAVE Coalition, Sacramento Alliance for Vaccine Equity, we have been holding weekly Friday clinics. And this Friday, December 10th, Team Heart and Hustle will be at the Pinnell Center from 3 to 6 p.m. to vaccinate our kids, everyone aged 5 and up, first dose, second dose, booster, come through. Please spread the word. Bring your kids, your siblings, your nieces, your nephews, your aunties, your uncles, your grandma, your grandpas, and sign up. You can simply walk in, or you can go to heartandhustle.org/vaccine to make an appointment, or you can just walk in. Also on that's on Friday. And then on Saturday, we're having another clinic at Mack Road Valley High Community Center from 11 to 2. So lots of options in South Sacramento. We always want to make sure that these clinics are accessible and they're also in language. We always have folks from our local CBOs, trusted messengers on the ground, ready to go to serve this community. If you don't speak English, someone don't speak English, we have someone on site that can provide assistance. So with that, I just want to say thank you so much to our amazing panel, Victoria, Trustee Yang, and Rachel. Thank you so much just for your heart and hustle and everything that y'all are doing during this pandemic to really protect our families and our kids. It takes an entire community to really protect all of us, and everyone plays a critical role. All of you who are leading a school district, is in the inner workings of the school district to protect our kids, and you who are watching now, your role is getting vaccinated so that we can reach herd immunity. That's so critical to make sure we protect our families and our communities. Last comment, if you need to contact my office, Council District 8, you can call us at 916-808-7008, or email my team, the Team Heart and Hustle at district8@cityofsacramento.org. Or you can also just follow us on social media. Our handle is exactly the same, CM My Vang on Facebook, Twitter, and Instagram. I also have TikTok as well. Don't use it as much. I'm going to start using it more because a lot of young folks are on there. But do follow us on social media to get updates about what's happening on council, initiative, projects, things that are happening in the community. And with that, I'm sending all of you lots of love, wishing you all a happy holidays and an amazing new year. If you celebrate Hmong New Year, Happy New Year's to all of you. We will be hosting our monthly live chat again in January. So I may not see all of you again until next year, unless I see you at a Christmas event or a community event, but we will be jumping back on in January again. And if I don't see you, happy holidays and have a great New Year's. And with that, sending y'all lots of love, lots of healing, and I'll see you all soon. Thank you so much, everyone.
Thank you. Thank you. Appreciate it. Thank you.